Understanding erectile dysfunction in young and older men, causes, treatments, and natural remedies. Welcome to Rerzeh, your ultimate health and wellness guide. Erectile dysfunction, ED, is a condition that affects millions of men worldwide, regardless of age. While it's often associated with older men, an increasing number of younger men are also experiencing ED. This video will explore the causes, treatments, natural remedies, and things to avoid for erectile dysfunction in both young and older men. By the end, you'll have a comprehensive understanding of how to address this condition and improve your quality of life. What is erectile dysfunction? Erectile dysfunction is the inability to achieve or maintain an erection sufficient for sexual activity. It can be a temporary or chronic issue and may stem from physical, psychological, or lifestyle-related factors. While occasional difficulty with erections is normal, persistent ED can signal underlying health problems that need attention. Causes of erectile dysfunction. Causes in young men under 40. For younger men, ED is often linked to psychological or lifestyle factors rather than physical health issues. Common causes include stress and anxiety, performance anxiety, work-related stress, or relationship problems can interfere with sexual function. Depression. Mental health conditions can reduce libido and affect erectile function. Substance abuse. Smoking, excessive alcohol consumption, and recreational drug use can damage blood vessels and reduce blood flow to the penis. Poor diet and lack of exercise. A sedentary lifestyle and unhealthy eating habits can lead to obesity, diabetes, and cardiovascular issues, all of which contribute to ED. Causes in older men over 40. In older men, ED is more likely to be caused by physical health conditions, though psychological factors can still play a role. Common causes include cardiovascular disease. Poor blood flow due to clogged arteries is a leading cause of ED in older men. Diabetes. High blood sugar levels can damage nerves and blood vessels, impairing erectile function. Hormonal changes. Declining testosterone levels with age can reduce libido and erectile strength. Medications. Certain drugs for blood pressure, depression, or prostate conditions can have ED as a side effect. Chronic illnesses. Conditions like kidney disease, multiple sclerosis, or Parkinson's disease can affect sexual health. In neurological disorders, conditions like Parkinson's disease, multiple sclerosis, and spinal cord injuries can disrupt nerve signals needed for erections. Treatments for erectile dysfunction. Medical treatments. Oral medications. Drugs like Viagra, sildenafil, Cialis, tadalafil, and Levitra vardenafil are commonly prescribed to improve blood flow to the penis. Testosterone replacement therapy. For men with low testosterone levels, hormone therapy can help restore libido and erectile function. Vacuum erection devices. These devices create a vacuum around the penis, drawing blood into it to produce an erection. Penile implants. In severe cases, surgically implanted devices can help achieve an erection. Psychological counseling, therapy can help address anxiety, depression, or relationship issues contributing to ED. Lifestyle changes. Exercise regularly. Physical activity improves blood flow, reduces stress, and boosts testosterone levels. Aim for at least 30 minutes of moderate exercise most days of the week. Eat a balanced diet. Focus on whole foods like fruits, vegetables, lean proteins, and healthy fats. Avoid processed foods, sugar, and trans fats. Quit smoking. Smoking damages blood vessels and restricts blood flow, making ED worse. Limit alcohol. Excessive drinking can impair sexual function. Stick to moderate consumption, 1 to 2 drinks per day. Manage stress. Practice relaxation techniques like meditation, yoga, or deep breathing to reduce stress and anxiety. Natural remedies for erectile dysfunction. Herbal supplements. Panax ginseng, known as the herbal Viagra, this herb may improve erectile function by enhancing blood flow. L-arginine, an amino acid that helps produce nitric oxide, which relaxes blood vessels and improves blood flow to the penis. A horny goat weed. This traditional remedy may boost libido and improve erectile function. Dietary changes. A pomegranate juice, rich in antioxidants, it can improve blood flow and reduce oxidative stress. A watermelon contains citrulline, which converts to L-arginine in the body and supports erectile function. Dark chocolate, high in flavonoids, it improves blood flow and reduces inflammation. Leafy greens and beets, rich in nitrates, which help improve blood circulation. The nuts and seeds, almonds, walnuts, and flax seeds contain arginine, which promotes nitric oxide production. Fatty fish, omega-3 fatty acids in salmon and mackerel support cardiovascular health. Acupuncture. This ancient practice may help improve erectile function by stimulating blood flow and reducing stress. Pelvic floor exercises. Kegel exercises strengthen the pelvic floor muscles, which support erectile function. To do them, contract the muscles you use to stop urinating, hold for 5 seconds, and release. Repeat 10 to 15 times, 3 times a day. Aerobic exercises. Activities like jogging, swimming, and cycling help improve heart health and blood flow. Things to avoid. Unhealthy habits. Smoking damages blood vessels and reduces blood flow to the penis. Excessive alcohol can impair sexual performance and reduce libido. Recreational drugs. Substances can interfere with erectile function. Poor diet. Processed foods, high in sugar, salt, and unhealthy fats, they contribute to obesity and cardiovascular issues. Sugary drinks, linked to diabetes and poor blood flow. Sedentary lifestyle. Lack of physical activity can lead to obesity, poor circulation, and hormonal imbalances, all of which contribute to ED. Prevention tips. Maintain a healthy weight. Obesity is a major risk factor for ED. Stay active. Regular exercise improves cardiovascular health and blood flow. Get regular check UPS. Early detection of conditions like diabetes or high blood pressure can prevent ED. Communicate with your partner. Open dialogue about sexual health can reduce anxiety and improve intimacy. Final thoughts. Erectile dysfunction is a common but treatable condition that affects men of all ages. Whether you're a young man struggling with performance anxiety or an older man dealing with age-related health issues, there are solutions available. By addressing the root causes, making lifestyle changes, and exploring natural remedies, you can improve your sexual health and overall well-being. Dealing with erectile dysfunction, ED, can be challenging, but having an understanding and patient partner can make a world of difference. A supportive partner who offers encouragement and avoids placing undue pressure can help create a safe and positive environment for recovery. On the other hand, rejection or criticism may worsen feelings of anxiety, shame, or inadequacy, further complicating the situation. It's equally important to be patient with yourself. Overcoming ED is a journey that takes time, and your body may need weeks or even months to respond to treatment and therapy. Celebrate small victories along the way, and remember that healing is a gradual process. By fostering open communication, seeking professional help, and maintaining a positive mindset, you can work together to restore intimacy and improve your overall well-being. If you're experiencing persistent ED, don't hesitate to consult a healthcare professional. They can help identify the underlying cause and recommend the best treatment options for you. Remember, taking action today can lead to a healthier, more fulfilling tomorrow. If you found this video helpful, hit the like button, subscribe, and turn on notifications so you never miss new health tips.